Hey guys, Nick the Nurse here. Today we're going to be talking about some of the signs and symptoms of the nursing problem, heart failure. Now, we need to be able to differentiate between the signs and symptoms of left-sided heart failure and right-sided heart failure. So let's get started. First and foremost, let's talk about left-sided heart failure. With left-sided heart failure, some of the signs and symptoms that might be exhibited include cardiomegaly, which is an enlargement of the heart, fatigue, an S3 gallop, tachycardia, nocturia, frothy, blood-tinged sputum sometimes, crackles and or wheezing upon auscultation is classic in left-sided heart failure, orthopnea, which is when you have a difficult time breathing when you're laying down, tachypnea, dyspnea, anxiety, and you also might have blood pressure changes with hypertension from the fluid retention or hypotension from pump failure. So you can have high and low blood pressures, and that's not really something that we want to see in our patients. This is differentiated from right-sided heart failure. With right-sided heart failure, you have JVD, or jugular vein distensions. These veins are going to start popping out of the neck looking like you're Arnold Schwarzenegger or you're a weightlifter. You also might see peripheral edema, which is particularly in the lower extremities, weight gain, ascites, right? You have that fluid accumulation in the abdomen there, weakness and fatigue, hepatomegaly, or an enlargement of the liver, and also oliguria, right? You're going to have a decrease in urinary output there. So there are a lot of signs and symptoms we just talked about. What are some of the ones that I think, if I was a nursing instructor, and as a former nursing instructor, I guess I'm still kind of a nursing instructor, but having taught in both RN and LVN/LPN programs, I can tell you that some of the most frequently tested signs and symptoms on nursing school exams, and some stuff that might even come up on the NCLEX, include things like S3 gallop. That's seen in heart failure, left-sided heart failure. You might, when you're doing your assessment, or if a question comes up that says a nurse is doing their assessment on Mrs. Lee in room 3B, what is an expected assessment finding that you might find if the patient had left-sided heart failure, and you as the astute nursing student would say something to the effect of crackles or wheezing upon auscultation with your stethoscope, right? And remember, with your stethoscope, always make sure that the metal is touching the skin so that you can hear that resonance on the stethoscope. Very important. At any rate, you want to know that you're going to see crackles and or wheezing upon auscultation. With right-sided heart failure, jugular vein distension, definitely a distinctive characteristic or sign or symptom that you want to be familiar with. Also that peripheral edema, ascites, hepatomegaly, weakness. Patient's going to be very tired, right? So remember all of these different signs and symptoms when you're studying for your nursing school exams and or for the NCLEX. They might come up. Will they come up? Who knows? But you as the astute nursing student need to be prepared for it all, because you want to be a nurse and I want to help you get there. Again, my name's Nick the Nurse. I really appreciate you watching my video today. If you'd like to check out my absolutely free, no cost, no obligation, not even 1 penny nursing videos, check them out, all free at www.nickthenurse.com. Again, that's www.nickthenurse.com. Thanks for watching today, and we'll see you next time.